Hi everyone, this is Cameron Eldred, and today we are going to be talking about integrating the lower extremity and spine evaluation and my personal beliefs and how I can do better. So a little bit about myself. I'm a current doctoral student in the Doctorate in Athletic Training program through Indiana State University, and I am a high school athletics trainer out at Rossville High School in Rossville, Indiana. I provide services for both the high school and the junior high all year around. And a lot of the things that we're going to be talking about are things that I would like to begin integrating into my current evaluation. Now, currently in my evaluation of the lower extremity, I'm clinically very comfortable with going through my questions, my observations, all of my testing, my range of motion, strength, special testing, functional testing, looking at very basic biomechanics, as well as basic posture, and of course, getting a very thorough history, doing all of the things that we were taught throughout our undergraduate degrees that we need to be focusing on hard, getting all the right questions, doing all the right tests, and trying to hone in and not do a complete evaluation of, the entire thing, but then of the entire body, trying to hone in on what exactly is going on with that injury. However, something that this assignment has forced me to look at is looking at the person as a whole. I always thought I need to narrow everything down as quickly as possible. I don't need to worry about anything but the injury. The injury is what matters. And that's true. The injury is what matters. My evaluation of the lower extremity is I'm very comfortable with finding the injury and understanding the pathology. But what I have realized is that I'm not going through the person as a whole. So some of the things that I would really like to look at, personal gaps in my lower extremity evaluation, are going to be the following. I would like to look at gait assessment a little bit more in depth. The reason I want to look at this is I would like to look at the evaluation of gaits and the effects on the kinetic chain. Now, gait assessment, we know, we're looking at weight acceptance. So we're looking through the initial contact and that loading response. So those are the first periods in that, and that's during that stance phase. And then, you kind of, as you go through the stride, you get into the single limb support. So you're looking at that mid stance and then the terminal stance. And then as you get further through into that swing phase, we start looking at the limb advancement. So we're bringing it through. So we're looking at that pre-swing, the initial swing, getting through the mid and then into the terminal, and then restarting as we go back into the weight acceptance. Now, the reason that I find this to be extremely important is we understand that lots of athletic skills are performed during practice or competition, and that these are initiated or started by the legs, where the athlete will either walk or run prior to executing these specific skills. So they're going through the gait before they do whatever it is that's sport specific. And the kinematic chains are used to describe the relationship between the body segments and the joint during the movement. So what I would really like to do is I would like to understand or describe the relationship between the movements of the lower limb and the pelvis and the hips in open and closed kinematic chains while walking. And this would be in order to assess the effects of those relationships. So understanding why exactly one phase of the gait is throwing off the rest of the gait. So I think that would be extremely important for me to understand, being especially at a high school where kids are being they're coming into themselves, they're beginning to grow and progress. Next, I want to look at nutrition and patient education when it comes to nutrition. So we understand that as athletic trainers, we need to look at proper hydration. We need to be able to recognize eating disorders. We need to understand the factors of nutrition when it comes to injury and recovery. understanding energy expenditure, so the supply and the demand, as well as meal planning, especially for some of these athletes who expend a lot of energy. And so I would like to be able to look at this through patient education. I looked at one study that was written, it's called Sports Nutrition Knowledge Among Collegiate Athletes, Coaches, Athletic Trainers, and Strength and Conditioning Specialists. And what it found is that those who had a background in medicine or nutrition or sports training had an understanding of nutrition and how to educate people, but they weren't educating people. And so coaches and athletes struggled. They didn't understand why nutrition was so important. Next, I want to look at psychological coping and identification, and specifically strategies that are used to cope with psychological distress. So psychological coping and identification, as an athletic trainer, we should be able to look at referral decisions, intervention strategies, symptom identification for specific psychological issues. And then I want to understand what athletes do in order to cope. So if it's self-talking, goal setting, imagery, relaxation, what are these specific things doing for the athletes? And one thing that I looked at was exploring temporal patterning of psychological skills used during the week leading up to competition and lessons for developing intervention programs. And what they found is that an implementation of a formalized and periodized psychological skill training program over continuous cycles can actually improve the psychological reaction of an athlete or a patient. So imposing this self-talk, goal setting, imagery, and relaxation in the long run helped the athletes more than just if they were doing it the day before a competition or anything like that. So doing it repetitively really helped them. The last thing I want to look at is neuromuscular training. So using the neuromuscular training in rehabilitation. Now, a lot of people know this just as balance. So you look at single leg balance, balancing boards, sport-specific activities. One article that I looked at, Neuromuscular Training for Sports Injury Prevention, a systematic review, found that doing these balance exercises brought in a decrease in ankle sprains. Now, if you started to mix interventions or doing multi-intervention training programs, such as running, stretching, strengthening, plyos, power training, they were actually able to track a decrease in occurrence of ACL injuries and acute leg injuries. So I think it would be extremely important for me to completely understand how mixing different interventions with balance exercises can truly help the athletes or patients that I'm working with in the high school setting. Now, how I'm going to apply all of these, gait assessment, I would really like to look further into application in the knee injury prevention, especially when it comes to things such as looking at pathological gait, such as neuromuscular conditions such as pseudoequinus, jumped, crouched, so knees bent, ankles dorsiflex, things like that, or musculoskeletal conditions such as arthritis, muscular dystrophy, that associate pain, muscle weakness, structural abnormalities, things like that. And I would like to improve my overall gait assessment improvement. Nutrition, I would like to be able to provide educational materials for the athletes, the coaches, the parents, the administrators, because that's my responsibility and my job. And I'd like to be a better example of this personally. So I'd like to implement a lot of the things that I will be teaching. Psychological coping and identification, I really need to up my own personal ability to identify psychological disorders. I would like to be able to provide educational material as well as referrals for these things and provide an opportunity to my patients to perform their own coping interventions. So I'd like to be able to provide them with information on how to do this. Lastly, I would like to look at improved implementation of balance and multivariate training. This is going to be very simple. That's something that I need to just do on my own, and I need to think outside of the box because I really don't have a lot of opportunity for utilizing other resources in my current setting. So again, thank you very much for listening. My name is Cameron Eldred, and thank you.